afternoon. Glad you're here today. My name is Shane Reeves. I'm the senator from the 14th District. This is my inaugural press conference as a new senator, so I certainly appreciate everybody being here today, and I'm specifically thrilled to be standing up here with some of my colleagues from the Senate and from the House, and then a number of individuals with healthcare coalitions, healthcare professionals in this area that care a great deal about this piece of legislation. This piece of legislation basically does two things. It's a bill that's going to raise the age of people allowed to purchase tobacco and vaping products to the age of 21. And it's also going to strengthen the penalties for those selling to minors by implementing more stringent licensing and accountability requirements. You know, we have a lot to be proud of in this state. We really and truly do. We are very, very healthy financially. Incredible low taxes, low unemployment, AAA bond ratings, great rainy day fund. But for as healthy as we are financially, we are equally that unhealthy physically as a state. 42 in heart disease, 43 in COPD, 45 in diabetes, 46 in lung cancer, 47 in stroke, and 43rd in life expectancy. There are now 42 states in America you actually live longer in than Tennessee at this point. And all of these are made worse by smoking, which we are currently 47 out of 50 states in smoking. We can do better. We must do better as a state, and we will. And this piece of legislation is a great step in the right direction to hopefully get our smoking under control and in turn get ourselves healthy fiscally, physically as well as financially in the state. So I've got some colleagues up here. Representative Bob Ramsey is carrying this in the House, and I'd like to ask him to say a few words if you would at this time.
Bob Ramsey, 20th District.
Can you, sorry.
I've been up here for 10 years and have each year watched the national rankings of Tennessee, either at the bottom or close there. And of course, one of the main issues for that is the prevalence of smoking. I've carried this similar bill several times and without any positive effect. About 4 years ago, I was at a health awards program for elementary schools, and one of the schools actually got an award for decreasing the prevalence of smoking in 8th graders. And it occurred to me that there's a serious situation of people younger than 18 having a very wide access to tobacco products. So since then, I've been focusing each year on bills. I'm so pleased that these fine senators have included me in this bill again this year. I'll put all that I have into it, and I thank all of those agencies and groups, including our veterans programs and our Army Guard, who have requested us each year, please stop sending us 18-year-olds that smoke. And so I thank all of you, the shareholders, for coming forward, for supporting us, and maybe this year we'll be successful, but we'll give it all we got.
Thank you.
Changing the age where you can buy cigarettes from 18 to 21 does make a big difference. And you know, I've heard people say, well, you know, you can vote and you can join the Army or the military when you're 18. Yes, you can, and that's an honor and a privilege. To buy cigarettes and beer is not an honor or a privilege, it's a purchase. There is a big difference. We want to be sure that we protect our children, and this is a good way to do it. Our health care costs continue to climb. Every year we see it get higher. This is a way that we really can bring that trajectory down. The older you are, if you begin to smoke, the more likely you can quit. The younger you are, the less likely. So we want to do everything in our power to try to raise that age. It does make a difference. Thank you.
Thank you. And I've been in the Senate now 16 years, and also I'm a family practice physician, so I see it on the healthcare side as well, and I see it now especially in our schools. So many students are smoking, using the vaping products, starting out young, and this increase in the age would help decrease that availability, especially in our schools. If we can prevent kids from starting to smoke, that they will not continue smoking later in life. The healthcare costs are just immeasurable, really. Our state, it costs about $2 billion a year that we know of, but smoking causes so many problems from children around smoke, to cancers, to COPD, to heart disease, to bladder cancer, the list goes on and on. So all we can do to discourage people from smoking, we realize this bill has a rather large fiscal note, so it will be difficult to pass, but certainly as a physician and trying to help the health of this state, I think it's the thing that we need to do. Thank you.
Thank you. Senator Briggs?
Yeah, thank you. I'm State Senator Richard Briggs from Knoxville. Like Senator Hensley, I'm also a physician. We've talked a lot already about how our population is not healthy, and it is a personal tragedy when we see some of these diseases, but it's a much bigger problem than that, because there's only 8 states in the United States that has more worker absenteeism. So for us to continue to have a healthy economic growth, to have a healthy economy, we've got to have a healthy workforce. And I think this bill will address part of that.
Thank you. So I was at church yesterday, and a gentleman came up to me and said, "So I understand you're carrying the tobacco bill." And I said, "Well, I am." And he said, "Well, my son this past summer has started vaping. He's having the hardest time stopping that." And I said, "Well, how old's your son?" He said, 16. And I said, 16. And he said, he came to him and said, "Dad, I am just so terribly addicted to this, I cannot stop." The 16-year-olds are getting it from the 18, the 19, and the 20-year-olds. And like Senator Carita said, 95% of everyone who smoked started before the age of 21. It's important, 21 does matter. We've got a couple of other individuals we'd like to have speak today. The next one is Dr. Dorothy Sennard, who is a pediatrician. And I'd love for you to say a few words to us, please.
Thank you, and thank you all of you. Tobacco use is one of the most important health threats to children, adolescents, and adults, according to the American Academy of Pediatrics. My name is Dorothy Sennard. I'm a retired pediatrician and a fellow in the American Academy of Pediatrics. I've been asked to explain how raising the minimum legal sale age of tobacco products to 21 would improve the health of Tennesseans. Tobacco use is the leading cause of preventable death in the United States, killing almost 500,000 people every year. Cigarette smoking harms almost every organ in the body and causes many diseases. It also reduces the general health of smokers. Smoking damages blood vessels and causes heart attacks, strokes, and peripheral vascular disease. Smoking damages airways and small air sacs in the lungs that are called alveoli. Lung diseases caused by smoking include emphysema and chronic bronchitis. Most cases of lung cancer are caused by smoking. Asthma attacks and wheezing can be triggered or made worse by smoke exposure and smoking. Although lung cancer is the most prevalent, smoking can cause cancer in almost anywhere in the body, including the bladder, blood, cervix, colon, esophagus, kidney, liver, pancreas, stomach, and airways. I'm particularly aware that smoking also causes cancer of the larynx and the oral pharynx because my husband is a head and neck surgeon at Vanderbilt. He tells me that the voice box and mouth cancers that he operates on are almost universally caused by smoking and drinking. In fact, if nobody smoked, 1 of every 3 cancer deaths would never happen. But death rates fail to highlight the suffering and disability these cancers cause, even for survivors. My husband's patients sometimes permanently lose their ability to speak and to swallow. As a surgeon, my husband's job is to cut the cancer out. As pediatricians, much of our life work is prevention. Preventing youth smoking initiation is an important strategy to reduce all of these tobacco-related diseases. A 2015 CDC study showed that 75% of the American public, including 70% of current smokers, supported a minimum tobacco purchase age of 21. Dare I say, 100% of pediatricians would support this important health legislation. Thank you.
Thank you. So long before before I was a senator, I've been a pharmacist since 1994, went to the University of Tennessee, and so my entire life, a big part of what we've done is dispensing medications to patients with chronic, complex, and rare diseases. And been working with hospice for many, many, many years as part of that, and just cannot tell you how many patients have been impacted by tobacco. So I have a fellow pharmacist here today that wants to say a few words, Dr. Cam Nola.
Thank you.
I'm Dr. Cam Nola. I'm a professor of pharmacy practice at Lipscomb University College of Pharmacy and Health Sciences. This is an issue very near and dear to my heart, both personally and professionally. Personally, I am seeing when my daughter comes home talking about friends who have started vaping, or as the teenagers use their slang to call it juuling, that her friends are struggling. They don't know how to quit. And I'm getting phone calls not just from my daughter's friends and my son's friends, but also the public. How do we help our children to quit this addictive habit? And they are all struggling with those issues of how do we help our children stop. Let's make it so they don't start in the first place. As a pharmacist, we have, for a long time, as Senator Reeves said, had the resources available to help those who want to quit. We know that multiple times it will take several tries before someone can quit because of the nature of the addiction. For a 13-year-old, a 14-year-old to struggle with an addictive disease so early in life is concerning about what that means long-term. So I applaud this group and thank you for the time.
Thank you. This has clearly been a team effort from the very beginning. You can see by our board up here, there's a number of different groups: American Cancer, American Lung, American Heart, and on, the different groups that are supporting a variety of the coalitions. And a lot of those groups are here today. Would any of this group like to say anything? Any of the coalitions? Anything on your mind or heart you'd like to say? Nashville Health is here. Okay, so we'll open up for questions at this point. In your minds. Yes, sir?
Yeah, what are the laws on this in Tennessee's 8 adjoining states, and what would stop an 18-year-old from going to, say, Kentucky or Georgia, conceivably 30 miles across the state line to get these products?
Well, it's my understanding that the only state around us that's increased the age is Alabama currently, and I believe it's going to increase to 19. But all the rest of the states are also 18. I don't know. I tend to think we need to focus on our own state and our own kids, and try to look at what we can do to try to help them out. Any comments?
If I could add to that, you know, those of us who have had teenagers, we know that it's pretty hard to really prevent them from doing anything they really want to do. But what we can do is place a hurdle. And as you say, if they have to go 30 miles, that makes it a little harder. And when the kids they hang with in high school can't purchase cigarettes just at the local convenience store, then they gotta reach a little further to try to find a place where they can buy. So our goal is, let's make it harder. Let's do everything we can to prevent young children from beginning to take up what is a deadly, addictive habit.
You all said something about it's going to cost money. Is that because the lack of sales, or how sales will disappear because of this, or is there a program or something that you all are planning to implement with this law also that costs money to implement?
Might be fiscal note.
What that is, it's the loss of sales tax revenue. And I think it's shocking to find out how much the sales tax revenue actually is when we sell to these people under 21 years, these young people under 21. It's really embarrassing. It's a lot of money.
Is there any thought about raising the taxes to offset it on cigarette sales for everybody else that can buy it? I mean, you've seen that done in other states, including Illinois, New York. Right here in Tennessee, the taxes are pretty low on cigarettes.
It still seems to me that if we could just prevent it from getting in the first place, it's a better option. For the $7 million fiscal note, you know, TennCare is estimating they're spending $148 million annually alone on tobacco-related illnesses. So it seems to me in the long term, it's a much better payoff at the state to get people off tobacco.
Many of you campaigned on small government principles, so how would you respond to someone who said that government shouldn't be regulating this sort of thing or adding more regulations to people's lives?
You know, the federal government already regulates the FDA has been very clear that cigarettes are a deadly addictive habit. I don't think that you can put this in a category of how big government is. It's really about how much do you love your kids, and how can we prevent spending taxpayer dollars to pay for smokers later in life. What we need to be doing is making sure that people don't smoke so that the rest of us don't have to pay for their care. So that's really the way to look at it in terms of, if you want to say, comparing that with government. We don't want taxpayer dollars to pay for care that we could have prevented the whole disease.
Go ahead.
And we're not setting up new regulations because smoking and purchasing tobacco is already legal. We just want to increase the age where you can purchase it, and just trying to better protect teenagers and younger smokers. So I don't see it as us putting more regulations. We're just changing some that we already have.
And the fact of the matter is, age does matter. I mean, it does matter. You know, 21 to drink, 18 to smoke. I mean, I feel pretty confident that if we want to decrease the smoking age to 16, I think we could probably get to being number 50 in the country in lung cancer pretty quick. But who wants to do that? 18 is where we are now. 21 will save lives. It will save Tennesseans' lives. Anything else?
Has the tobacco industry, I'm sorry, go ahead. I guess I'll do it. Has the tobacco industry put up any sort of fight that you know of?
Not directly to me. The only comment that I have heard from a couple of folks in the tobacco is they recognize it's a real problem, and the vaping has made it even worse, and it's a real concern to the state. As far as directly coming to see me, they have not.
From what I've heard from they actually support keeping vaping products away from adolescents, so I don't think that they would really oppose this bill too much.
What about what would the Senate Speaker and House Speaker think about this? What's the sense of like how this might fare this year versus in years past where it's failed?
Go ahead.
You know, we really should let them speak for themselves. I think the biggest hurdle that we're going to have to overcome with this will be just the fiscal note on it. And again, I think it's what price do we pay to try to keep young people from smoking?
And I would speak on behalf of the House. This is the first year, as I said, for 10 years I've had these bills. This is the first year that they have been allowed to be assigned outside of the Agriculture Committee. So actually the bills this year are assigned to Health and other committees. So I think that's a step forward and a very positive response from our leadership.
What are the penalties if either a kid has a smoking product, or if if a store sells the product to the kids? Are there penalties that are associated with this law or enhanced enforcement at all?
Well, this bill actually takes away any penalties on the minors. This penalty is focused specifically on the retailers that are selling it. I've got all the details on the bill, which I can give to you, but in essence, there is a fine, but ultimately it can involve suspension and even revocation of the tobacco license in time. So there's more teeth in the actual bill as far as retailers, not focusing on simply punishing the minors.
Time for one more question? All right, thank you very much.
Thank you for being here today.